Hello and welcome to Karen's Medical Corner. I'm Karen O'Day. I'm a certified family nurse practitioner and a certified nurse midwife, owner and operator of EverCare Family Practice in Santa Fe, New Mexico. My specialty is women's health, family practice, aesthetics, bioidentical hormone replacement for men and women. I'd like to thank you for joining the podcast today and taking time out of your busy schedule to listen to some medical information. Today I'd like to do a podcast on the signs and symptoms of leukemia. And this is important to me as my dad has had chronic lymphocytic leukemia for the past 20 years, which was initially not diagnosed by his primary care provider. So I just want to start with a little story on his experience, which he's given me permission to tell. And it also involves me as well. So this is something that's very personal for me. So back in 2003, around August, my dad had been to visit with my mom. It was probably around the end of July for her birthday, and he had told me he was experiencing some lymph node swelling. And this was in Edgewood, New Mexico, and I try not to treat family members unless absolutely necessary. And so I told him, I said, well, call up your PCP when you get to Farmington and have them just run some blood work. It's probably nothing but get it checked out. And so I didn't really hear anything else about it for a while. About 3 months went by and I saw my dad again and I said, hey, whatever happened with those swollen lymph nodes? And he said, well, I still have them. And I called my PCP and he said I was too healthy to justify a blood draw and that Medicare wouldn't pay for it. And at this time, my dad was 65 years old. And one of the leading causes of swollen lymph nodes is leukemia in that age group, especially in men. So I told my dad to come to my clinic, which was New Mexico Primary Care and Midwifery Services in Edgewood, and that I would draw his blood. And again, I was thinking, oh, he probably had a cold or something a few months back and was still just getting over the lymph node swelling. But he was coming through Edgewood, and this was actually about a month later. It was near Christmas. He was coming through Edgewood, and so he came in and we drew his blood and I sent it off to the lab. And on December 30th, I got a call from the pathologist at the lab, and he said, hey, Karen, who's this guy, Wes Lovett? And I said, oh, that's my dad. And he said, well, he has leukemia, chronic lymphocytic leukemia. And I was stunned. I drew his blood to find out what was going on. It was a simple blood draw, but I was not expecting that diagnosis. So I called his PCP in Farmington and I said, hey, I just want to let you know that this patient who is yours was just diagnosed with CLL from a blood draw that I did today. And the PCP said, oh, well, you sound a little bit upset. And I said, yeah, well, you know what? It's my dad. So, he came to you 3 months ago with complaints of swollen lymph nodes and you didn't draw his blood. And he, in fact, does have leukemia. And so his PCP said to me, oh, well, would you like me to give him a referral to oncology here in Farmington? And I said, no, you know what? I think I'll handle that myself. You've done plenty. Thanks so much. And I said goodbye. And that evening, I decided, I need to go up to Las Vegas, New Mexico, where we were all going to meet up for New Year's. And so I left that night, got up to where my parents' ranch is, and then the next morning I told my dad, I said, hey, I got that blood draw back, and I just have to tell you that you have chronic lymphocytic leukemia. And that was probably the hardest thing I ever had to tell anybody at that point ever, because it really sucks. Number one, that his PCP blew him off, and number two, that his daughter diagnosed him, that I had to diagnose him with leukemia and then tell him that he had the diagnosis. And that was really rough. And I had talked to one of my receptionists the day prior to, and I said, can you get us an appointment with the best cancer treatment in America, that being MD Anderson? And she called me on New Year's Eve and she said, Karen, I've got you an appointment with MD Anderson on January 3rd. So literally 4 days later, which was incredible. And she was an absolutely amazing receptionist. So we flew to MD Anderson in January of 2004, and he's been getting treatment there ever since and doing fairly well. So I thought it would be important. I'm here at MD Anderson right now with my dad for treatment that he's been going through, and I thought, I don't know if everybody out there really knows about the signs and symptoms of leukemia, and if they do, on the importance, if they're having symptoms, on not being told that they're too healthy to have a blood draw. So some of the symptoms, so there's different types of leukemia. There's acute leukemia and there's chronic leukemia. But the symptoms tend to be the same when people initially start having symptoms. Acute leukemia oftentimes progresses much more rapidly. Chronic leukemia usually progresses much more slowly, although that's not necessarily the case for everybody, depending on genetic mutations and markers that are associated with different forms of leukemia. But this is not a podcast to talk about the different forms of leukemia, just signs and symptoms. So a lot of times, one of the first symptoms that people will start to have is fatigue or feeling tired all the time. Also, they may experience, like my dad did, increase in lymph node swelling. They'll feel the glands in the neck or the glands near the collarbone being swollen, sometimes in the armpit as well, or in the groin area. So that can also be an initial sign. Intermittent fevers for no reason, and chills, or an increase in night sweats, not associated with hormonal changes, but this would just be random. All of a sudden you start having night sweats for no reason. Recurrent nosebleeds, easy bruising. Sometimes people will find that they start, they'll cut themselves and they don't stop bleeding as easily. They might have unintentional weight loss. Now, that's usually associated with more progressive disease, not something that you would see in initial stages. Frequent infections or more severe infections that normally would be cleared without difficulty. Someone may experience that they have a harder time clearing those up. They might have the feeling of during either a physical exam, or if they feel something in the abdomen, it could be an enlarged liver or spleen. More progressive type of symptoms of leukemia would be tiny red spots on the skin called petechiae. Sometimes also people have bone pain or bone tenderness. And also one that I think is probably more common in kids than in adults would be coughing, persistent cough. There's no illness, there's no fever, but the cough just kind of keeps getting persistently worse for no apparent reason. Now, cough can be associated with a lot of different things, but that's just one symptom of leukemia. So anybody who's having any of these symptoms, if they're persistent, and I never want to make anyone panic, but like with my dad, he'd had swollen lymph nodes for 3 months that weren't going down. That's something that's persistent. Chronic bruising that's just kind of persistent. If you're not drinking alcohol, you're not on blood thinners, you're not taking a lot of fish oil, vitamin C, there's no reason for your blood to be thinning, then that would be an indicator that, hey, maybe I want to go get a workup. The workup is very easy. It's a simple blood draw. You just check somebody's complete blood cell count, which checks their red blood cells, white blood cells, platelets. Do a differential to break down the white blood cells so you can look at the lymphocytes, neutrophils, monocytes, eosinophils, and basophils to see what's going on. And that is going to be a fairly easy diagnosis. So if anyone is experiencing those symptoms, I encourage you to call your primary care provider and discuss with them possible appointment and workup. There are many other possible etiologies or causes for this variety of symptoms, but certainly this is one to be aware of. And I want to thank everybody for joining me for this podcast today. And I'd like to thank Kathy V and Crystal and Amanda and Laren for listening. And I wish everybody health and happiness and the continued ability to make all of your own healthcare choices that you feel are right for you. If you have any questions or comments or concerns regarding this podcast, feel free to contact me. either on my website at www.evercare.com, on my email, which is evercarefamilypractice@gmail.com. You can call the office if you're interested in an appointment at 505-780-8301, or you can comment or contact me on any of the different platforms that this podcast is broadcast on. Have a good evening. Thank you.